Hello viewers. Dr. Mark Spencer will be taking you through this tutorial of the skin disease, acne. Please you can kindly subscribe to enjoy more videos of diseases and their diagnosis series. Enjoy the show.
Well, let's begin with the general overview. Acne is a skin condition that occurs when your skin follicles become plugged with oil and dead skin cells. It often causes whiteheads, blackheads, or pimples, and usually appears on the face, forehead, chest, upper back, and shoulders. Effective treatments are available, but acne can be persistent. The pimples and bumps heal slowly, and when one begins to go away, others seem to crop up. Depending on its severity, acne can cause emotional distress and scar the skin. The earlier you start treatment, the lower your risk of such problems. Below are major signs and symptoms of acne. These vary depending on the severity of your condition. For example, whiteheads, closed plugged pores; blackheads, open plugged pores; small red, tender bumps termed as papules; pimples, which are papules with pus at their tips; large, solid, painful lumps beneath your skin, also called nodules; painful pus-filled lumps beneath the surface of your skin, medically termed as cystic lesions. When to see a doctor. If self-care remedies fail to clear your acne, visit the doctor. They may prescribe stronger medications. If acne persists or is severe, you may want to seek medical treatment from a specialized doctor for skin, a dermatologist. For many women, acne can persist for decades, with flares common a week before menstruation. This type of acne tends to clear up without treatment in women who use contraceptives. In older adults, a sudden onset of acne may signal an underlying disease that requires medical attention. The Food and Drugs Administration (FDA) warns that some popular non-prescription acne lotions and other skincare products can cause serious reactions. This type of reaction is rare, so don't confuse it with the redness, irritation, or itchiness where you've applied the medication or products. Seek emergency medical help if you experience the following symptoms after using a skin product: faintness, difficulty in breathing, tightness of the throat, and swelling of the eyes, face, lips, or tongue. But what are the causes of acne? There are 4 main factors that cause acne, including 1. Excessive oil production; 2. Bacteria; 3. Excessive activity of a type of hormone, androgens; lastly 4. Hair follicles clogged by oil and dead skin cells. As we said earlier, that acne typically appears on your face, forehead, chest, upper back and shoulders. This is because these areas of skin have the most oil glands, to which hair follicles are connected. The follicle wall may bulge to produce a whitehead, or the plug may be open to the surface and darken, causing a blackhead. A blackhead may look like dirt stuck in the pores, but actually the pore is congested with oil and bacteria, which turn brown or black on exposure to air. Pimples are raised red spots on the skin, with white centers, that develop when hair follicles become inflamed or infected by bacteria. Blockages and inflammation that develop deep inside hair follicles produce cyst-like lumps beneath the surface of your skin. Other pores in your skin, which are the openings of the sweat glands, are not usually involved in acne. Myths and factors that have little effect on acne include: greasy foods. Eating greasy foods has little to no effect on acne, though working in a greasy area, such as kitchen with fry vats, does, because the oil can stick to the skin and block hair follicles. This further irritates the skin or promotes acne. Hygiene. Acne is not caused by dirty skin. In fact, scrubbing the skin too hard and cleansing with harsh soaps and chemicals can irritate the skin, thereby worsening the acne. Also, cosmetics do not necessarily worsen acne, especially if you use oil-free makeup that does not clog pores. And also should remove makeup regularly. Non-oily cosmetics don't interfere with the effectiveness of acne drugs. The following are the main factors that increase the risk of developing acne. Age. People of all ages can develop acne, but it's more common among teenagers. Hormonal changes. Such changes are common in teenagers, women and girls, and people using certain medications, as earlier said. Family history. Genetics plays a role in acquiring acne. If both parents had acne, one is likely to have it, too. Friction or pressure on your skin. This can be caused by items such as telephones, cell phones, helmets, tight collars and backpacks. Greasy or oily substances. One can develop acne when their skin comes in contact with oily substances such as oily lotions and creams, or with grease in their work area. Lastly, stress. This does not cause acne, but if you have acne already, it may make it worse. Preceding are the most recommended forms of treatment. If you have tried over-the-counter, non-prescription acne products for several weeks and they have not helped, a doctor can prescribe you some medications, or a dermatologist can help you control your acne, avoid scarring or other damage to your skin, and even make scars less noticeable. Acne medications work by reducing oil production, speeding up skin cell turnover, fight bacterial infection, or reduce inflammation, which helps reduce scarring. With most prescription drugs, you may not see results for 4 to 8 weeks, and your skin may get worse before it is better. It can take months or years for acne to clear up completely. The treatment your doctor recommends depends on age, the type and severity of your acne, and what you are willing to commit to. For example, you may need to wash and apply medications to the affected area at least twice a day for several weeks. Often topical medications and drugs you take by mouth, oral medications, are used in combination. Pregnant women will not be able to use oral medications for acne. Talk with your doctor on the risks and benefits of the medication you are considering. The topical medications include 1. Retinoids and retinoid-like drugs. These come as gels, creams and lotions. You apply this medication in the evening, beginning with 3 times a week. Then daily as your skin gets used to it. It works by preventing plugging of hair follicles. 2. Antibiotics. These work by killing skin excess bacteria and reducing redness. You may use both retinoids and an antibiotic by applying the antibiotic in the morning, then the retinoid in the evening. The antibiotics can be combined with benzoyl peroxide, which reduce the risk of antibiotic resistance. However, use of antibiotics alone is not recommended. 3. Salicylic acid and azelaic acid. Acid azelaic is a naturally occurring acid found in whole grain cereals and animal products. It has antibacterial properties. Its cream seems to be as effective as most conventional treatments for acne when used twice a day for at least 4 weeks. Prescription of this is an option during pregnancy and while breastfeeding. Side effects include skin discoloration and skin irritations. Lastly, 4. Tampons. This gel can be applied twice daily and is recommended for inflammatory acne, especially in adult females, though the side effects are redness and dryness. Others include oral medications such as antibiotics, like tetracycline drugs e.g. minocycline or doxycycline or macrolide. Combined oral contraceptives can be used by women. Anti-androgen drugs such as isotretinoin, which is powerful for people whose severe acne does not respond to other treatments.